Okay, good morning, good afternoon, good evening po sa lahat-lahat. Saan man panig po kayo ng mundo naroon. Welcome to our 141st 141 episode of Stop COVID's webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And for all those who have just discovered us for today, welcome po at sana po marami po kayong matutunan sa very interesting topic na pag-uusapan natin ngayong araw na ito. At ito po ay patungkol sa inborn errors of immunity, a group of rare genetic disorders that affect the immune system's ability to fight infections and respond to foreign substances. Marami pong kailangan po ng mga espesyalista. It requires a multidisciplinary approach in the diagnosis and management and involves especially sa immunology, genetics, infectious disease, and other clinical specialties. In recent years, efforts have been made to improve its diagnosis and management in the Philippines by the work done by the Philippine Society of Allergy, Asthma, and Immunology. And hopefully, through this webinar, we're able to help raise awareness and provide education to healthcare professionals and the public on how to deal with IEIs po and get a better sense of understanding on improving it dito po sa Pilipinas. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of Philippines, Manila. Always a pleasure to be with all of you during our regular Friday and always looking forward to Fridays we get to share hosting duties with our adjunct research faculty, beloved mentor, also renowned public health communications expert, Dr. Susie Pineda Mercado. Dr. Susie, how are you feeling?
Nako, good afternoon, Raymond. Magandang hapon po sa inyo lahat. Raymond, can you hear me? Kasi
yes, but just a little bit. Medyo paos.
Lalapit kaya ako. Anyway, magandang hapon po sa inyong lahat. I'd like to greet all of you who are with us on Zoom and those of you who are watching on YouTube and Facebook. Alam nyo, paos ako. This is a post-COVID effect. Kasi after COVID, ang tagal kong inuubo, so nawala po yung boses ko. Pero meron pang konting boses lumalabas. I hope you can bear with me. I'd also like to greet all of those who are watching on TVUP, Signal, Channel 1. Oh, wala na talaga, Raymond. Okay. Raymond will do most of the talking today.
yes.
Kasama, no? Dahil napakahusay po ng ating mga speakers. Our main speaker is Dr. Fatima Santos Ocampo, or Joni. She is the head of the Immunologic Disease Council of the Philippine Society of Allergy, Asthma, and Immunology. The reactor will be a mom who has 2 children who have IEI. So pag-uusapan natin yung IEI. Mami Julianne Amora, thank you so much for being with us today. And our synthesis and closing remarks will be by Dr. Stella Jose, who is head of the PGH Office of Expanded Education and Training. Raymond, pumapalya na.
Sige, yes. Thank you for pushing further, Dr. Susie. Marami pong salamat and really marami po kaming pag-uusapan. Marami po tayong pag-uusapan for today and we cannot wait to hear from our excellent lineup of speakers. But before that, napansin nyo naman po that during our opening billboard, we have transitioned to broader discussions on how the pandemic has affected health outcomes. Kaya beyond COVID-19. So hindi na lang po tayo nakatutok sa COVID per se, although we have maintained it in the title and put it in as an acronym po of sorts. And since we know that you like to always be kept abreast of the latest news in health and medicine here and abroad, we have a segment in the webinar called The News Update. Okay, for our very first news update po, ang katanungan po natin is, will artificial intelligence replace doctors? And something that everyone has been asking kahit saan mong pong sector, AI replacing lawyers, etc. But this time, we'll be focusing on the doctors. And the question was posed by researchers from Northwestern University. The gist of it is that maybe not entirely, but the doctor-patient relationship is definitely going to change dramatically. For now, the need for human interaction in healthcare is likely to keep artificial intelligence on the sidelines as a complement rather than as a substitute for doctors. The dramatic change will be those who leverage the use of artificial intelligence will really outpace those who do not. So obviously something to think about as we take measures in improving the care that we deliver to our patients. How about you, Dr. Susie?
Okay, so China records the first human death from H3N8 bird flu. A Chinese woman has become the first person to die from a type of bird flu that is rare in humans. According to the World Health Organization, this strain does not spread between people. 56-year-old woman from the southern province of Guangdong was the third person known to have been infected with H3N8 subtype of avian influenza. All the cases have been in China, with the first 2 cases reported last year. Though it's rare in people, H3N8 is common in birds, and the birds don't show any sign of disease. It also affects other mammals. So that's our news for today. We'll continue to monitor this bird flu, but we'll be back next week with more on the news update.
Thank you so much, Dr. Susie. Tuloy-tuloy lang po tayo. And going back to our webinar topic for today, very excited na po, obviously, lahat po na nandito. Pati na rin po sa mga nanonood po sa TVUP Facebook and YouTube channels as well as sa ating Stop COVID Deaths po na Facebook channel po. No? Pati na rin po sa Signal patungkol sa topic na inborn errors of immunity and primary immunodeficiency conditions. But before that, we will introduce po ito pong tinatawag nating person on the street video, which we use to set our discussion into context, and we cannot thank the TVUP team enough for really week in and week out working on producing these types of videos. And the question that we pose to the common folks on the street, may kilala po ba kayong sakitin? Paano po ninyo nasabing mahina ang immune system ng isang tao? Sa palagay po ninyo, ano ang mga dahilan kung bakit humihina ang immune system? Please watch this.
Oo, may kilala ko. Especially yung mga tao na may bisyo.
Meron akong pamangkin na madalas siya sa ospital nung bata siya.
Yes, yung nephew ko. So I don't have a kid, but my nephew is super sakitin.
Sakitin. Yes, of course. Marami pa akong kilalang taong sakitin.
Especially yung mga tao na may bisyo tulad ng pag-inom ng alak, paninigarilyo, at hindi pagkain ng tama.
Parang madali siyang mapagod kung yung mga expected na mga basic tasks hindi niya kaya magampanan agad.
So, my nephew was a bit short for his age, saka underweight siya. Na-notice namin medyo madali rin siyang magkasakit. So, easily mga colds, ganyan. Sobrang bilis niya magkasakit.
Kung siya ay madaling mahawaan ng sakit, madaling magkaroon ng sakit, kung sa simpleng pag-iba lang ng panahon ay madali siyang makapitan ng sakit tulad ng ubo at sipon.
Mahina ang immune system ng isang tao kapag siya ay hindi agad gumagaling sa mga simpleng ubo, sipon, or lagnats.
Ayun, ang tao kasi pwedeng through genetics, pwedeng through lifestyle choices, kaya humihina yung immune system ng isang tao. Mas pwede siyang ma-address ng, halimbawa kung magulang ka, ngayon kasi pwede na nating idaan sa newborn screening yung mga bagong anak natin para makita kung meron ba siyang mga nataglay na mga genetic nga na baon ng mga pwedeng maging sakit or mga deficiencies sa immune system.
So, from nutrition marketing speak, yung root cause is really proper nutrition. So, usually kapag kulang yung nutrition ng bata, tapos ang indication nun is hindi siya right height and weight for his age, that impacts yung immunity niya. So, may tinatawag na growth immunity cycle. So,
dahil sa hindi pagkain ng tama, pagpapabaya sa sarili, at pagkakaroon ng maraming bisyo at hindi pag-ehersisyo araw-araw.
So, dapat ang isang tao ay nakakakain nang hindi lang basta kumakain. So what I mean is kumakain siya na merong sapat na nutrients na natatanggap yung katawan niya.
Dapat ma-address yung, halimbawa, yung mga kinakain, saka yung pangangatawan, yung mga lagi sinasabi na through diet and exercise, yun talaga yung pinakasimpleng pag-maintain ng immune system, intake din ng mga vitamin-rich na pagkain. Tsaka
Nutrition, yun yung one thing. And then yung second is you really have to do proper exercise. So as you expose them in the outside world, yan, you have to make sure then may enough exercise. So yun tatlo pa rin. So nutrition, exercise, and sleep. So sleep, kailangan yung recommended sleep for a kid is usually 8 to 10 hours. So if you have those three, then you can build immunity.
Wow, thank you so much, TVUP, for those interviews. It's always very interesting, Raymond, to hear these perspectives. And we're going to learn more about the immune system with our very special guest today. So Raymond, you've got some housekeeping, but before you go into it, I just wanted to ask for paumanhin sa mga nalilate yung kanilang mga certificate of attendance. We had a change in staff in our entire production. So medyo may konti po kaming, anong tawag nito, Raymond? Parang may transition.
Transition.
So
Causing
pasensya na
some
po
delays.
kayo kung medyo nalilate, pero binabantayan po ni Raymond yan. Si Raymond po kabunin nyo. Sige Raymond, over to you.
Thank you, Dr. Susie. And that's our segue to to our certificates of attendance. Yes, we still continue to give out certificates of attendance, and they are for those who have watched at least 50% of the webinar duration. We take note of those who have provided multiple requests for their certificates all the way back to maybe 4 or 5 or maybe even 10 webinars ago. So we'll keep an eye out on that and keep reviewing our systems po, no? And please continue to email us at stopcovidence@up.edu.ph so that we continue to track all of these requests. For our webinar today, we'll be having our standard panel discussion format, and after our speakers have presented, we'll hear from our reactor po, no? Followed by a Q&A session. But before we delve into our webinar proper, which I know everyone is excited, we have our cute intro video for our fun quiz segment for today.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
We retain the bunny for Easter, Dr. Susie.
Pang-Easter nga, Raymond, pang-Easter. Parang pang-Easter egg hunt, no?
Oh, yes, that's true. That's true. Can we have on the poll on the screen na po? Thank you so much. And can we have it on Zoom as well? Okay, we have 2 questions po for today. For our very first question, what are the 3 red flags which serve as the basis for having a high index of suspicion for a patient having inborn errors of immunity or IEI? Is it A, need for IV antibiotics to clear infections, failure to thrive, and family history of IEIs? Is it B, need for IV antibiotics to clear infections, food intolerance, or fever? Letter C, family history of IEIs, recurrent allergies, and requiring surgery. Or letter D, failure to thrive, sudden weight loss, and skin rash. Medyo mahirap po itong first natin. Medyo nasanay po tayo sa all of the above. But I think it will be very helpful for us as when we learn of the correct answer towards the end of the program. We'd like to take this opportunity to greet those who are joining us all the way from the West Visayas State University Medical Center in Iloilo City. Maraming salamat po. From Provincial Health Office of Marawi City, Lanao del Sur. From Camp Navarro General Hospital in Zamboanga City. From IFSU Eye Center in Ifugao. From RNL Medical Clinic in Aloran, Misamis Occidental. And from Itbayat District Hospital all the way up north sa Batanes po. Maraming salamat. Thank you rin po sa mga nanonood from UP Los Baños, from Bataan, from Bulacan Medical Center Department of Pathology and Laboratory Medicine, those from Rizal Medical Center, thank you so much. Those who are joining us din po from well, their Easter greetings po, no? But thank you po sa lahat, lalo po from Isabela, from our regulars po, no? From Bai, Laguna. Thank you so much. Also joining from Philippine General Hospital, from Morong, Rizal, University of Rizal System Health Services po natin. Mamaya na po ang ating mga international attendees. From Cavite, may nanonood din po from Deca Homes, Loma de Gato, Marilao, Bulacan. Thank you so much. Bataan, from RPHS Annex 1 in Antipolo City. Maraming salamat po. There are those also watching from Pasig City. So thank you everyone. For our question number 2. Question number 2 reads, what management strategies are available for patients with IEI? Is it A, hematopoietic stem cell therapy? Is it B, immunoglobulin replacement therapy? C, prophylactic antibiotics? D, genetic counseling? Or E, all of the above, lahat po na nabanggit. Batiin ko rin po nanonood from La Consolacion University Philippines, from Malolos, Bulacan, University of Rizal System in Taytay, and internationally from Island Hospital in Pulau Pinang, Malaysia, from Chonin Hospital in Taipei City in Taiwan, and Ali Lunichin University in Larba, Algeria, and from Hail in Kingdom of Saudi Arabia. Thank you so much. Hindi po namin muna ito i-close ang ating questions that are shown on the screen. We'll leave them open po as we move on to our webinar proper, to be introduced first the main speaker by Dr. Susie.
Thank you so much, Raymond. So let's get this on the way. And our main speaker is, I will say, the best, iba, in our field. Kasi yung apo ko na nagka-allergy at parang hinihika, dyan ko pinadala sa kanya. She is the head of the Immunologic Council of the Philippine Society of Allergy, Asthma, and Immunology. Let's give a warm welcome to Dr. Fatima Joanna Joni Santos Ocampo. Joni, welcome to the webinar.
Hi, good afternoon, everyone, colleagues, doctors, mommies, daddies, and regulars ng Stop COVID webinars. Shall I start?
Yes
Yeah,
po, go ahead.
Oh, okay. All right. Share. And then put my screen. And then let's do this.
Parang malaki siya, Raymond. Ano?
Ayan. Can you see my screen now?
Yeah,
Yes, it's better po. It's better.
Nice.
Medyo malabo lang po, pero I think we should be okay.
Malabo
Good.
siya. Oh, okay.
Oo, parang out of focus.
All right. I don't know how to fix that from my end.
Let's look at your next slide, Joni.
I hope it can.
Baka yung
Okay.
cover slide lang.
How's that?
Ayan, okay, better po.
That's good. That's good
Ang
na.
title lang
Sige na,
pala.
go na. Go ka na.
Okay,
Go ka na.
Ayan. So ito pang title ng talk natin, no? Immune system, usapang immune system. Pasensya na po sa technical terms. Try ko pong bawasan, ano, para mas maintindihan. So, inborn nga ba siya? Ito pong objectives ko. And then, okay. So, yung pong term that we use for a weak immune system ay yung immune deficiency. It's a failure of the immune system to protect the body adequately from infection due to the absence or insufficiency of a component, process, or substance that's important in its workings. There are two main types. Ang isa ay ang innate error of immunity or primary immune deficiency, at mayroon ring secondary or acquired immune deficiency. Okay, so ang primary or inborn error of immunity, yan po yung mga sakit na karaniwang galing sa mga genetic mutations na nakakaapekto sa kakayahan ng labanan ang pathogens or mikrobyo sa normal na interaction or pakipag-ugnayan sa ating microbiota. Yan yung good and bad bacteria, no, narinig nyo na siguro na nakatira sa katawan natin, or sa pagre-regulate ng autoimmunity and inflammation. It's primary because there's no other disorder or external factor that's causing it. Ang secondary immune deficiency naman ay yung panghihina ng ating panglaban sa infection or immunosuppression. But this time, it's acquired later in life. No? Hindi yan sa pagkapanganak. Maaring epekto to ng mga gamot, as in yung mga ginagamit for preparation for bone marrow or other organ transplantation to prevent rejection of the donor tissue, or yung mga high dose and prolonged use of systemic steroids. It may also result from certain diseases such as your AIDS, yung HIV, yung lymphoma, or mga anti-cancer drugs themselves. Other causes of secondary immune deficiency ay makikita natin later under the topic mimickers of IEI at the end of my talk. Malaking bagay na ma-distinguish natin ang dalawang ito, no? Dahil ang management ay magkaiba. Note na ang IEI po interchangeable po sa PID or primary immune deficiency. So medyo minsan nag-shift ako. Okay. So today, ang pag-usapan natin ay ang inborn errors of immunity. And we won't go into detail about the immune system. Napakalawak nitong usapin. But I just wanted to show you this. Ito yung mga lymphoid organs, no? Like the tonsils, yung thymus, yung adenoids, yung lymph nodes, mga vessels niya, bone marrow, kasama yan, yung ating mga appendix, yung Peyer's patches na nasa bitukan natin, ano? And of course, the white blood cells na nakakidaloy sa blood natin. So may mga important chemicals rin tayo na tinatawag na cytokines, chemokines, and growth factors. And these are involved in the cell stalking, na cross-talk ng cells to each other sa loob ng network ng immune system. There are two basic parts of the immune system. Itong sa left, kita nyo, is the innate, no? Part of the innate immunity natin. And these are the ones that are ready to attack, no? Always present. But it's the primitive form. Ito yung unang na-develop na first-line defense ng mga tao. Kaya in time, no, in the evolution, natututo rin yung mga mikrobyo na ma-resist siya. So it's not the most potent immune defense. So just take note yung mga cells nandito, yung mga phagocytes, dendritic cells, natural killer cells, yung tinatawag na complement, even yung skin barrier natin is part of that. No? And then on the other side is adaptive immunity, and it is stimulated by continuous exposure to the microbes, and it is more potent. So this time, mas malakas siya, it makes use of inflammation in neutralizing microbes. No? So ang inflammation ay maaaring kakampi natin sa paglaban sa infection, or pag hindi kontrolado, pwede namang nakakasama. So dapat laging may balanse. At yun rin ang trabaho ng immune system na ibalanse ito. Okay. So are almost 500 known genetic disorders na ang nagko-comprise ng IEI. While some have as yet unknown genetic basis, no, hindi pa natutukoy ang cause niya. This IUIS classification is based on what part of the immune system is affected. O sige ha, medyo wordy ito, pero please bear with me. So, itong part na ito, immunodeficiencies affecting cellular and humoral immunity, the ones with combined immune deficiencies associated with syndromic features, predominantly antibody deficiencies, yung under the adaptive immune system, kung naaalala nyo. And then, ito namang diseases of immune dysregulation, autoinflammatory disorders, phenocopies of inborn errors of immunity, congenital defects of phagocyte number or function, defects in intrinsic and innate immunity, and complement disorders. These are the ones naman involved under the innate immune system. Si bone marrow failure, unique siya kasi ang pagkukulang niya nasa source ng lahat ng mga immune cells na ito. Plus, may kukulang rin siya sa ibang partes ng dugo. Tulad halimbawa ng anemia na nangyayari dun sa Fanconi anemia na is also classified as IEI. Okay, so the leading concern sa sakit na ito ay infection. But increasingly, nakikilala na ang mga iba't ibang manifestations niya tulad ng autoinflammatory, kaya makikita niyo mga pangalan nandyan, autoimmune, immune dysregulation, even bone marrow failure, cancers, or severe allergies. Pag may breakdown sa immune system, no, ang isa pang apektado ay yung surveillance sa function or yung pagdedetect at pag-capture niya ng mga abnormal cells na sige-sige ang growth na over-proliferate. Dito pwede magsimula ang cancer. Itong rason kaya nagkaroon ng ganitong classification, no? So we'll touch on those other manifestations later. All right, so some of them, this patient may have an appearance that may clue us in. For example, itong tinatawag na Job syndrome, no? Na CID siya with syndromic features. So, di ba, parang may broad forehead, deep set eyes, medyo flat ang nose, at saka, ano yan, may mga fractures, no? So yung iba naman, yung itong autoimmune lymphoproliferative syndrome na kalalaki ng mga kulani, no? Andiyan dyan, pwedeng obvious yan. Now, meron tayong yung tinatawag na chronic mucocutaneous candidiasis na sobrang grabe ang yeast infection, no? Hindi lang sa loob ng bibig, sa labas, yung mga kuko apektado, no? Or sometimes meron tayong tinatawag na granuloma basidiosis. Ano to? Ito yung nangyayari pag may IEI ang bata tapos binigyan mo ng BCG. Ito, imbis na protektahan siya sa TB, nagkakaroon siya ng mga swellings dahil dun sa BCG, nagkaka-infection siya na dahil sa BCG. Kaya may malalaking mga swellings na dun sa side kung saan siya binigyan ng bakuna. Now, often than not though, normal ang itsura nila. Ito, example, si Bubble Boy in the 1970s, siya si David Vetter. Siya yung patient na may severe combined immune deficiency or SCID. Wala siyang makikitang halatang abnormality pero ang tindi ng immune deficiency niya. Okay? So, kailangan maging alerto tayo. Paano? Okay? Ito, hanapin natin ito, SPUR. Ano yon? SPUR. S stands for severe infections. P, persistent infections, no, yung ang hirap gamutin. U, unusual organisms or unusual infections. R, recurrent infections or refractory to treatment. So, minsan kasi ito lang ang pauna o tanging palatandaan na may IEI pala ang pasyente. Okay, now ano ba? Based on a phone survey, no, of 27,000 individuals in the US, no, it was seen that it has a prevalence of up to 1 to 1,200 population. Now, ang US highly developed yan, no? Pinakamalapit siguro itong value na ito sa katotohanan ng prevalence ng sakit na to. Kumpara sa developing countries, sa tulad natin. So sa buong mundo, base dito, may 6 million katao who are living with IEI. But you know what? Only 27 to 60,000 have been diagnosed according to the formal registries. Doon sa Asian countries with registries, it can range from 1.1 to 2.3 per 100,000. So lumalabas, napaka-small fraction ang nadadiagnose. This means that in the Philippines, malamang potentially may 88,000 plus Pinoys ngayon, pero hindi natin alam. Okay. Meron tayong tinawag na 10 warning signs by the Jeffrey Model Foundation na nagsilbing guide, no, to make us suspect IEI. Pag may 2 or more na warning signs na ito, magsuspecha ka na ng IEI. No? So ito, let's go over it. Ito, 4 or more new ear infections within a year, 2 or more serious sinus infections within a year, 2 or more months on antibiotics with little effect, 2 or more pneumonias within 1 year. Itong failure of an infant to gain weight or grow normally or failure to thrive, and recurrent deep skin or organ abscesses, persistent thrush in the mouth or elsewhere on the skin after age 1, need for IV antibiotics to clear infections, more than 2 deep-seated infections katulad ng mga sepsis, and a family history of primary immunodeficiency. Okay, medyo mahirap-hirap pang magkabisado, itong tatlong ito, tandaan nyo to, very good pick-up. Itong family history, itong need for IV antibiotics, and failure of an infant to gain weight or grow normally. Okay, so later on, it was noted that hindi siya noon ka-high yield if you use it alone. Ang baba ng sensitivity, tingnan nyo, 56%, specificity of 16%. And then, merong mean diagnostic delay of around 3 years if you use it alone. So there is really a need to improve on our screening methods. Okay, one way to do is to ask the right questions tungkol sa infections. You know, many experts say that you don't need to wait for 2 or more deep-seated serious infections, tulad ng bone abscesses, brain abscesses or sepsis, para magsuspetsa ng IEI. Unang-una, marami na tayong mga bakuna ngayon, very effective. They help minimize yung mga serious infections, more conscious tayo sa hygienic practices. So, hindi dapat nagkakaroon ng ganitong infection basta-basta kahit minsan. So, for our doctors, no, in the audience, may I appeal, no, to you, let's be as good in identifying the causative microbes and knowing what antimicrobials to use, as also being curious and ask why the patient acquired the infection in the first place. So from there, pwede tayong mag-imbestiga at pwede na rin makipag-usap sa immunologist. Okay? We should review, no, the type of infections that the patient has and watch out for signature infections. Ito yung mga mikrobyo na madalas associated with a particular type of IEI. For example, etong recurrent strep or recurrent Neisseria or yung gonococcal or disseminated or yung nagre-result sa arthritis, no? These are suggestive of complement or antibody deficiency. Ang mga ito naman ay suggestive of phagocytic defects from a bacterium in particular has been seen to have a higher than the usual association among Southeast Asian males with IEI. Dito naman, we see yung mga skin, lymphoid, pulmonary, liver infections, kunyaring caused by Staph aureus na liver abscess, yung Aspergillus, Enterobacteria, Salmonella, Proteus, BCG, non-tuberculous atypical mycobacteria, nocardia, yung mga taong sanay ay mga infectious disease, a specialist there. I'm sure parang familiar, di ba? Parang AIDS kasi ang problema nito ay cellular immune deficiency. So, how about yung mga microbial susceptibility associated with known and emerging IEIs? Just a few examples, no? Meron tayong nalaman na mutation in the IFNAR2, okay, which is a gene that's important in making cells responsive to the interferons, which are part of our antiviral defense system. It results in fatal encephalitis after you give your live MMR vaccine. And then just last year, merong IFNAR1 deficiency naman that was shown to predispose to herpes simplex encephalitis. Doon din sa similar to the one with the UNC93B dependent TL3 immunity. Don't worry, wala namang masyadong ganyan ng mga words after this. Now, let's just look at some more recent evidence. No? A recently published study in an Istanbul PID center, no, showed the following observations. Ito, recurrent respiratory tract commonly seen warning signs, followed by failure to thrive, and followed by recurrent hospitalization. Yung mga arrow. Tapos, hyper-IgE, nephilia, are notable disease, which may or may not be related. Now, about half of the patients unions, which is not unusual kasi sa ganyan sa kultura nila. And interestingly though, 70 pag inad mo tong dalawa, organomegaly, and this is most probably due to immune dysregulation. Ano yun? Immune dysregulation is the breakdown or malfunction of the molecular control of the immune system, pagbabalanse ng mga proseso ng immune system, causes autoimmune and inflammatory conditions. They are the second most common clinical consequence of IEIs. Immune regulation, body deficiency, combined immune deficiency, and complement deficiency.
Raymond, I think we lost Joni. Raymond. Raymond, did we lose Joni? Ayun. Joni, go ahead. We lost you for a moment. Go ahead. Can't hear you.
Unmute yourself, Joni. Unmute. Naka-mute.
Okay, can you hear me now?
Yes, yes, yes. Go ahead.
Okay, thank you. So itong mga APECED, IPEX, no? ALPS, autoimmunity and autoinflammatory conditions has been the hallmark of these diseases. Pero at the same time, they all have increased susceptibility to infections. Okay. So in
Johnny,
predominantly
Johnny,
antibody deficiency,
your slides are not visible. Parang nawala yung slides mo. Let's see what happened.
okay. Hello? Ayan.
Parang nag-freeze yata yung nag-freeze.
How about now? What are you looking at? Can you see? Should I end muna and go back?
No, it's okay. Just try to open your slides again.
Okay. Kasi it's open. Hold on. I'm gonna end it. I'm gonna go back, ha? Kasi I don't know what's going on. And then I'm gonna go and present again. And then...
Unshare. You're sharing kasi.
Can you see?
So,
Ay, sorry.
sharing. Wala pa. Wala
Oo
pa.
nga pala. Okay. I will unshare. I have to go to Zoom and unshare. Okay. Okay. Hold on. I am looking at you now. So meaning I've unshared, right? Tama?
Yes, now share it again. Share again.
Okay. I will now share.
Yan. Okay lang yan. Kuha natin.
Advanced. Okay. Okay.
Yun. Okay, go to presentation.
Oo. Kasi
Presentation
ang bagal ng mag-respond. Presentation mode tayo. Okay. Ang bagal. Okay.
Okay. Oops, too big yata.
Sorry po. Ayan.
Medyo malaki
yan.
yan. Okay.
Ayan.
Ayan.
Sige,
Okay,
continue,
salamat.
please.
Alright.
Okay, go.
Where was I? So ito yung sinasabi ko yung sa predominantly antibody deficiency, no? Marami tayong nakikita ng mga hematologic abnormalities, mga thyroiditis, nephritis, inflammatory bowel disease, and rheumatoid arthritis na lahat autoimmune. Yan, no? Tapos, yung sa combined immune deficiency, merong example, for example, yung Omen syndrome, no? Up with alopecia or IBD-like symptoms and also idiopathic thrombocytopenic purpura. Yun namang sa Wiskott-Aldrich syndrome, no? You can see autoimmune thyroiditis, type 1 diabetes, and Addison's disease. Autoimmune cytopenias as well, mga autoimmune enteropathy, and some less common autoimmune presentations. Now, for the defects in the early components of the classical pathway ng complement system, no, there's increased susceptibility, especially towards SLE, no? And then yung sa alternative pathway, yung deficiency of mannose binding lectin, it's been linked to an increase in rheumatoid arthritis, ITP, enteropathy, pernicious anemia, and vitiligo when associated with common variable immune deficiency or CVID. And then, ano bang sabi ng mga kaibigan nating rheumatologists, no? They have reported in a cohort of 33 patients na 5 patients or 15% of that had IEI. And then may additional 12% who had decreased levels of immunoglobulins, B-cell number, abnormal vaccine response, pero did not meet criteria for a defined IEI at the time of the study, pero very suspect. So pag inad mo, 27%, almost 1/3. Now, in a large cohort naman, with more patients, 224, autoimmunity was the presenting or the only symptom for a small subset of IEIs, tulad ng common variable immunodeficiency. No? Sige, skip na natin yan. And then, I'd like to make special mention of GI inflammatory disease kasi may recent systematic review last year that showed the prevalence of IBD or inflammatory bowel disease in IEIs that range between 3.4 to 61.2% depending on the underlying IEI. Diarrhea and abdominal pain in over half the cases were commonly reported findings. May colon ulceration, seen on endoscopy, cryptitis, granulomas, ulcerations, and neutrophilic lymphocytic infiltrates were the most frequently reported histopathological abnormalities. Now, ang treatment ng IBD in people with IEI or PID depends on the severity of the symptoms and the underlying pathogenesis. So, napaka-individualized ang approach ng management niya. IEI is also a prominent predisposing factor towards malignancy or yung mga cancer. Here, yung cancer would present at a younger age, mga between 5 years old, 9 years old. Majority is lymphoid. They tend to be less of the Burkitt's type, but more of the large B cell, the Hodgkin's type. Marginal zone lymphomas are seen in younger patients in this group instead of the usual adolescent or young adults where they usually present. Now, the histopath features that will distinguish solid tumors linked to IER are not clearly delineated. So, hindi natin masyado maasahan siya. So, just be clued in if the cancer type in children are those that are rarely seen in the pediatric age group. Some known to have specific links, for example, squamous cell carcinoma and Fanconi anemia, yung CD40 ligand deficiency, resulting in cryptosporidium-induced sclerosing cholangitis, which leads to cholangiocarcinoma. Now, after a carefully conducted history taking, you may already refer to the immunologist right away. Pero it also helps if you get some basic tests, no? Example, a CBC, an updated one, no, where an absolute lymphocyte count or ALC and absolute neutrophil count or ANC can provide stronger evidence of a deficiency in a lot of cases. Now, pag low yun, it's a red flag, should be followed by quantification of lymphocyte subsets. Nagagawa natin to in major hospitals in NCR, but is best interpreted by an immunologist and should use age-appropriate range of normal values. Now, itong IG or immunoglobulin levels are already considered routine for screening as well. Except for the genetic testing, no, in this list, all these are actually considered basic tests, no, in other places abroad. But it hasn't caught up locally because nga of the knowledge gap among practitioners, limited availability of some of these tests, and additional out-of-pocket cost to the patient. So usually kaming immunologists ang nag-end up mag-o-order nito to prioritize which test to do first. Now, genetic tests based on a clinical suspicion may sometimes turn out to be more cost-effective, especially if the biochemical tests are not locally available. Yun yung mga DHR or yung mga mga lymphocyte activation, yung mga ibang test na yan. Now, or you cannot even send them out kasi minsan kailangan ng fresh sample pag gagawin sa lab, no? So we are actually able to send out for genetic testing, no, to Hong Kong kung gusto natin ng free, courtesy of our connections with Hong Kong University. They actually just need the processed DNA, which can be done at our very own NIH lab at the UP-PGH, no? Yan. So what are the basic principles of management? It is highly dependent on the diagnosis. A definitive diagnosis based on a compatible confirmed genetic mutation or specific biochemical test will dictate the kind of management. So ito yon, stem cell na tinatawag or hematopoietic stem cell therapy, HSCT. It's the most well-studied definitive treatment. If done early, it can ensure more than 95% long-term survival ng mga pasyente. Now, we're working towards it pero hindi pa yan naumpisahan dito. Meron sa Hong Kong, Malaysia, Vietnam, Taiwan, no? They're doing it. Now, bago pa yan, a very important treatment called immunoglobulin replacement therapy or yung IVIG can already help. It's beneficial to more than 70% of patients. It can serve as a bridge, no, or pangtawid habang naghihintay sa stem cell treatment. Now, we also have important life-saving infection prevention measures tulad ng up-to-date vaccines. But you have to know what's safe to give and what's not safe to give. Now, for example, yung pagbibigay ng BCG, live attenuated vaccine, no yan for patients with combined immune deficiency or chronic granulomatous disease or CGD. For example, you have a prospective parents who had a child na may unexplained recurrent infections, never napacheck ang immune system. Tapos they're expecting na ngayon another child. Siguradong magbibigay ang bakunang ito kasi part ito ng API bago makapagpa-check kung may IEI genes nga ba o hindi ang pamilyang ito, no? So we can be in big trouble, no, with the next baby as well. So the other side of the coin naman, administration of age-appropriate vaccines becomes very important. Ito na, yung COVID-19. Alam na natin, kailangan ng extra dose kasi having IEI and COVID talagang mataas ang mortality rate niya. Then, the use of prophylactic antimicrobials. It can be a game changer, no? Lalo na sa Philippines, sometimes hindi naman tayo makakapag-afford mag-send abroad para magpa-stem cell or napakabigat sa bulsa ng IVIG. Yung prophylactic antimicrobials nakakatulong talaga, no? So it can extend yung life habang naghihintay ng more definitive treatment. Then, we need to advise the patients and the doctors nila regarding proper preparation of blood products. Pag kailangan ng transfusion, we have to use irradiated or leukoreduced preparation, especially for those with cellular immune deficiency to prevent yung tinatawag na fatal graft versus host disease or GVHD. Okay? Then we also emphasize the much needed advice on genetic testing, not only for the patients, but also for the parents and siblings. Yung genetic diagnosis kasi the treatment will depend on this talaga. Hindi uniforme ang treatment ng IEI. In fact, ito yung nagsimula ng original na example ng precision medicine. Ang unang stem cell, ang unang transplant happened in 1965 for X-linked A-gamma globulinemia, no? It's a B-cell deficiency. Okay, in recent years, no, we established an IEI support group, and you will meet one of our members later when she shares her experience. All right, so ito yung sinasabi kong IEI mimickers. I gathered this list based on their propensity to cause recurrent fever or recurrent infections mismo or symptoms that may be mistaken for infections. So in 50% of these cases, no, these individuals have normally functioning immune system, but example, yung mga children na meron ng 12, 12 urti na per year. Don't panic yet. You have to ask, patient ba started daycare or preschool o baka merong older sibling na nag-start ng schooling? And of course, don't forget to ask about exposure to smokers. Kasi alam natin, di ba, yung ear infection, ano dyan, pag smoker yung mga nasa bahay. So if the answer is yes, then it's probably not an IEI. Now, in some naman who might have a pneumonia bout or 2 or 3 uncomplicated na ear infection in the first years of life, it's less likely an IEI kung viral pala siya, responds quickly to treatment and recover completely, tapos normal lang growth and development and healthy in between, so it's probably an IEI. Yung mga unusual cases lang, yung mga tinatawag na Munchausen by proxy, for us, we have to bear that in mind kapag may unusual cases ng infection. In 30%, ito, allergies might be involved. The patient might be having cough, for example, wheezing, which may be mistaken for chronic or recurrent urti. If there is no fever, walang lagnat, especially nagre-respond sa allergy and asthma medications, walang documented spur, patient is growing normally, and no signs of immune dysregulation, then it's less likely an IEI. However, ito, pag uncontrolled yung allergic rhinitis, for example, it can predispose to recurrent or persistent urti because yung inflamed mucosa na yan, kapitin niya ng mga microbes, madaling mag-invade, alter immunologic response niya. Then, what you might be seeing is more of a complication of inadequately treated atopic disease. And the same can be seen in controlled rhinitis, which can result in repeated bacterial superinfection of the skin. Now, there is a caveat to this, no? In recent years, more studies have shown varying degrees of associations of allergic rhinitis, asthma, food allergy, and eczema with IEI. Can you hear me? All right. You can hear me?
Yes, ma'am.
Yes, yeah, we can hear you. Go ahead. Please go
We
ahead.
can hear you. Go
Okay,
on.
okay. All right, and major allergies seem to affect patients, no, actually less than in the general population. So, especially yung merong predominantly antibody deficiency and combined immune deficiency. So, ang problema actually, pag nag-present ng allergy yung pasyente, it can delay the diagnosis of IEI, no? And it was seen in 75% of cases. So, we have to do a very good para yung okay, yung 10%, may mga anatomical, physical barriers, and other exposures that can mimic condition of IEI. For example, yung mga barrier breach or failure. Ano ba to? Minsan yung mga taong aksidente, na fracture yung tinatawag na cribriform plate, yun yung nasa base of the skull na connected sa brain, or meron yung skin, nagkaroon ng sinuses, nakakapag-enter ang mga bacteria doon. So it can be a cause of recurrent infection pala. And then yung mga inadequate clearance of secretion. For example, ito, yung may CNS condition na hypotonic, hindi maayos yung pag-swallow ng reflex ng patient. So pag pinapakain mo, it can go to the lungs, nagkaka-aspiration pneumonia, yung mga ganung type. And then merong mga tinatawag na obstruction. For example, yung mga dysfunction ng eustachian tube. Yan yung connection ng ears to the lalamunan or malalaking tonsils, adenoids. Nakakapag-block yan ng normal flow ng secretions, at pagka nag-back up yun, it can be a medium for bacterial growth. Then, yung mga may sakit sa puso na, kunyari, na nakakapag-overload ng pulmonary vascular bed, it can cause congestion. So, prone to infections yun. And even the itsura of congestion on the x-ray, mukhang pneumonia nga Now, yung iba naman, meron silang abnormal valves or damaged valves na can cause endocarditis or can throw emboli all over the place. That can also be where infection can start, or tinatawag na nidus ng infection. Yung mga foreign bodies, yung mga may central line, mga VP shunt, mga catheters, or yung mga batang naglalaro, nilagay sa tenga or sa ilong yung beads or yung part ng eraser or pearls. Pag naiwan yan doon, pwedeng nidus for infection na naman yun, na hindi mo alam nandun pala. Meron tayong resistant organisms na usually happens in an hospital setting, kasi iba ang mga microbes sa hospital, matitindi. So it can happen to immunocompetent patients in the hospital. Ngayon mga continuous infection lang, tingnan nyo yung environment. Kasi minsan may sasabihin, Dok, bakit nagtatai palagi itong anak ko? Or sa lahat sila or whatever, yung pala contaminated ang water supply nila. O Dok, bakit ang daming parang galis-galis naman sa skin ng anak ko or parang ang daming abscess, Yung pala, hinahag yung infected na pet na hindi na papagamot. And of course, yung Munchausen again na unusual cases na pwedeng pagmula ng repeated and even unusual infections. Yung mga sinasabing protein-losing disorders, I don't know if you can see this, Okay, protein-losing disorders, for example, may sakit sa kidney or merong tinatawag na malabsorption syndromes. Ibig sabihin, yung mga proteins natin na building blocks ng body, immune cells, ng mga antibodies, so ano mangyayari? Wala kang building blocks for immune cells and antibodies, Malnutrition, ganun din, pero hindi nag-drain, kundi kulang ang pasok, And then extremes of age, yung very young and very old, talagang ang immune system nila ay mahina. So talagang meron silang parang secondary immune deficiency talaga. And of course, yung na-mention nga, sleep deprivation, wala kang puyat, extreme stress, and a harsh climate can also wreak havoc on your immune system. Okay, so andito na ako sa summary. I just want to say that everyone has got to be aware and be updated para you have a high index of suspicion so that you have a lower threshold to refer to the specialist. Basic tests are available and you can use them already. And then if in doubt, look for and discuss possibilities of IEI mimickers with the immunologist to be a better advocate for your patient. Okay, so kung gusto nyong makahanap, sino ba itong mga immunologist na to? Pumunta po kayo sa aming Philippine Society of Allergy, Asthma and Immunology. Go PSI.org, click nyo po, makikita nyo to, and then itong nasa right upper corner, find an allergist, pag-clinic nyo, eto po, may directory kami. So saan man kayo sa Philippines, meron pong immunologist na pwede nyong makontak. So I think that's my last slide. Thank you po, and I welcome your questions.
Thank you very much, Joni. Oh, namamangha pa ako sa lecture ni Joni.
Very
Ang
nice, very
galing-galing.
nice.
Hoy, wala ba tayong virtual clap of
Virtual
appreciation?
clap, virtual clap.
Oo. Thank you so much, Joni. You can unshare now. Yan. And I think, you'll see the appreciation of our audience for your presentation. Siguro marami silang mga katanungan, no? Kasi very interesting talaga, no? But highly, highly specialized work which many of us can really learn from. Okay, so Raymond, over to you.
Thank you, Dr. Joni. Obviously, marami pong may katanungan. I saw a few hands raised, so we'll answer those questions later on. But for now, we'll have si Mami Julie Ann Amora to open up her audio and her video, and she'll be sharing her their entire journey, their challenges and experiences for their family that their family experience in their journey towards getting correctly diagnosed and managed for inborn errors of immunity. Ma'am Julie, go ahead.
Good afternoon po. How not to miss primary immunodeficiency in your child po. Meron po akong 2 sons, not 1 but 2. Dalawa sila na meron pong XLA, short for X-linked A-gamma globulinemia. Medyo natakil po siya ni Doc Joni kanina ng konti. Ito po yung primary immunodeficiency disorder wherein yung katawan po nila cannot produce or unable to produce immunoglobulins. So alam po natin na yung immunoglobulins is very important for their immune system kasi po yun yung nagfa-fight against mga infections. So at 3 months old po, dahil wala akong idea or walang idea yung family namin na may ganong history. Actually, 4 kaming girls. So walang affected kasi boys lang yung affected. So carrier possible si nanay. So since walang boys, wala pong nagkakasakit palagi. At 3 months old, yung our eldest son started having persistent colds. Never na po nawala yung sipon, ubo. So dati parang may sipon lang hanggat hindi po nilalagnat, oregano, mga ganyan, nung mga ganong mga treatments lang. Hindi ko po siya dinadala sa doktor hanggat hindi naman nilalagnat. Simula po nung 18 months old, nag-start na siya magkaroon ng recurrent pneumonia. Na-confine na po siya. First time na-confine is 18 months old. And then, every gagaling, lalabas, every 2 months po, laging may recurrent pneumonia. Since paulit-ulit po yung pneumonia niya, na-damage na po yung lungs niya which led to bronchiectasis. Unfortunately, irreversible po yun. So, every day, as in 24/7, meron siyang ubo and may phlegm. Since nung baby po siya, 3 months old, meron na siyang atopic dermatitis. Medyo grabe kasi parang nagbabalat yung face niya. Sobrang pula. So, yun yung isang napansin namin. Kasabay po nung recurrent pneumonia niya, nagkaroon, lagi rin siyang may ear infection, which is yung otitis media. And then kasabay po, meron din siyang gastroesophageal reflux disease. So, ang sabi lang ng mga doktor, since lagi nga siya nagsusuka, nagsusuka, hindi masyadong effective yung oral medicines. So, tsaka yung lagnat niya laging 40, 39, 40. So, lagi kami nako-confine para daw through intravenous yung mga antibiotics na sabi din po ni Doc Joni kanina na isa yon sa talagang yung tatlo, kasama yung sa tatlo na dapat bantayan mo sa mga merong primary immunodeficiency. So, he's been in and out of the hospitals for 4 years, not really knowing what real cause of his infections of system or symptoms were. Fortunately, we were referred by my cousin to a pulmonologist who is a pediatric pulmonologist at the Philippine Children's Medical Center. Kasi po kino-consider na namin na ipa-opera yung lungs nung anak ko kasi sabi nung doctor is parang yun yung makakatulong. So, he performed a thorough physical examination to Caleb, which is my eldest, and ordered a comprehensive laboratory test such as immunoglobulin panel test and T and B cells enumeration. Nung lumabas po yung results ng test ni Caleb, almost zero lahat ng IgG serum levels niya. Zero din yung CD19. And then yung ibang mga CD niya po, hindi normal. Merong sobrang baba, merong dapat hundreds lang pero thousands yung sa kanya. So, hindi normal. Yung pulmo po na yun, meron na siyang first patient na XLA. So, si Caleb yung pangalawa niya in 30 years of service niya or experience niya sa medical field. So, after po nun, ni-refer niya na agad kami sa immunologist kasi po, parang immune system yung nakikita niyang problema dahil paulit-ulit yung lahat ng mga infections ni Caleb. As in, same po yung mga symptoms. Lalagnatin, uubuhin, sisipunin, laging ganun po. So, nung ni-refer na po kami sa immunologist, yun na, nang nakita na po yung results ng immunoglobulin serums niya and CD19, nabanggit na nga po ni Doc na primary immunodeficiency. So, ang treatment plan na po agad is mag-start na kami immediately ng IVIG replacement therapy infusion every 3 weeks. Sa PCMC namin po yung ginawa. My son responded well with the therapy treatment, and for 3 years he never had pneumonia. So very life, parang game changer talaga yung IVIG sa amin kasi since nung nag-start yon, never na po siya talaga na pneumonia. As in, na lagi naming problema ever since nung nag-start ng 18 months old siya. My son responded well with the therapy. He had been well until COVID hit home in 2021. So nung nag-COVID, na-stop kami ng IVIG. Pero okay pa naman siya for 9 months. Pero nag-resume na din po kami. Kahit takot ako na ibalik siya sa hospital, we really need to do the IVIG kasi yun yung nakakatulong talaga. So nag-resume na kami sa IVIG, umokay na siya ulit. Not until nung 2021 po, nung Delta, yung grabe yung Delta, na nahawa po siya. May bumisita lang sa amin, nahawa siya. 2 beses siya na COVID, Delta and Omicron. He was admitted to the hospital due to the severe infection and was treated with remdesivir and tocilizumab. Actually, medyo grabe po yung nangyari kay Caleb kasi muntik na siyang ma-intubate. Pero sinabayan pa din po ng IVIG. Nung nagtitreat siya for COVID, sinabayan pa din ng IVIG. With God's grace and the doctor's healing hands, he recovered. So, nung na-COVID po siya, nung Delta, okay, naka-recover naman siya, pero sobrang tagal namin talaga sa hospital, 20 plus days po. Nung time na yun, buntis na ako ulit. So, 2021 yon. So, I gave birth to my youngest son, lalaki ulit. Actually, nung ultrasound pa lang, nung nalaman ko na lalaki, parang napapikit agad ako kasi parang, oh my God, lalaki ulit. Tapos, hindi naman siya through IVF, normal, lang po, conceiving. So, medyo may worry talaga ako. And since we already knew that PID is often genetic, we discussed the possibility of genetic testing with our immunologist. After the counseling with the geneticist, we immediately proceeded with the test at UP Laboratory, wherein kinuha yung specimen and then yung DNA. Then they sent the specimen to Invitae in the US. After more than a month, we were informed that me and my eldest son, Caleb, were positive to XLA. Carrier po ako and then nasalin ko siya dun sa panganay. So, hindi po muna tinest yung dalawang bata. 3 kasi sila. Hindi muna tinest yung dalawa since kung hindi ako carrier at sporadic case lang daw po yung Caleb, parang nagkataon lang na nagkaroon siya, hindi na po itetest yung iba. So, since carrier ako, nag-positive ako, tinest na din yung dalawa. Fortunately, yung babae ko, hindi siya carrier, pero sadly, yung bunso, parehas ni Caleb. So, 2 na sila na XLA patient. So, nung lumabas yung result po, nag-communicate na ako sa immunologist and then ni-refer na po niya kami sa PGH po. So, now, my two sons are being treated with IVIG therapy in PGH every 3 weeks po. So far, both of them are responding well to the treatment. Wala naman po akong napansin na hindi magandang side effects during the IVIG infusion, and after po ng IVIG infusion, wala naman din po, like nanlalata, nagsusuka, nilalagnat, wala po. So okay naman yung nararanasan nila during IVIG. It's just that very painful lang sa parents na makita kasi every 3 weeks tapos lagi silang tinutusok ng karayom. So bilang parent po ng dalawang XLA patient, hindi po naging madali yung pinagdaanan namin bago namin na-detect yung sakit ng eldest ko. Unfortunately yon, na-damage yung lungs niya, naging bronchiectasis na, which is irreversible, lagi siyang may phlegm. Kaya nung nalaman namin na ganun, sobrang ingat na po talaga namin. Kumbaga, parang XLA or PID change our lives. One critical aspect of their health is their immune system, which protects them from infections and diseases. Pero yun po yung affected sa kanila. Missing the signs of primary immunodeficiency in your child can have serious consequences and potential long-term health issues like with Caleb po. So yung sa bunso, talaga pong inagapan namin kasi ayoko siyang matulad nung damage na nangyari kay Caleb dahil nga late na po namin siya na-detect. 4 years old na po eh. So medyo marami ng complications na nangyari sa kanya. Here are some essential tips based on our family's own experience on how not to miss primary immunodeficiency in your children. Number 1 po, educate yourself. As parents, it is crucial to educate yourself about PID. Kasi po it will really help po yung ikaw mismo nanay, kunyari po may sinabi sa iyo yung doktor, wag lang yung papasok lang sa isang tenga mo tas lalabas ulit sa kabila, parang hindi mo masyadong iniintindi since yung nasa nakataya yung buhay nung anak mo. Though tingin ko lang naman parents na ganito, so very important po na you educate yourself, magbasa-basa ka, sumali ka po sa mga webinars, yung may mga sa YouTube, meron mga doctors din po internationally mga nagdi-discuss. So, yun po mga sinasalihan po namin, yun yung sister ko, lagi po kaming nagtitingin sa mga ganon. So, second po, know your family history. Third po, monitor your child's overall health and development. Lalo po dun sa anak ko, si Caleb, since may isip na siya ng konti, laging, anak, pag may nararamdaman ka, sabihin mo sa akin, may masakit ba sa'yo, masakit ba yung ulo mo, nanlalata ka ba? Lagi ko po siyang pinapaliwanagan na i-communicate niya sa akin kung ano yung nararamdaman niya for me to know. At saka po, parang pag nanay ka po kasi tapos isang ubo lang ng anak mo, parang alam mo na Tapos pag isang ubo, gising ka na agad kahit madaling araw yan. So, very important that you monitor your child. Kahit wala ka sa bahay kasi you work, or meron kang ginagawa sa labas, lagi ko po talaga silang chine-check doon sa nag-aalaga. Pagka merong, ate, pag may konting nararamdaman, inform nyo ako agad kasi hindi namin po pwedeng ipagsawalang bahala or ay okay na yan, gagaling lang yan, hindi po pwedeng ganun. So lalo PID sila. Number 4 po, consult with your pediatrician. Very important po sa mga sakiting bata na lagi po ipapa-check up sa pediatrician at saka po sa mga doctors para po yung pagkakasakit is ma-updated sila. Ganun po. Tapos po pagka may follow up on abnormal lab results. Actually po si Caleb, nung lagi siya nagkakasakit, hindi po normal din yung lumalabas sa mga lab results niya. Pero hindi pa din po talaga na-detect na PID siya. So, yung mga CBC niya po, katulad po yung sinabi ni Doc Joni na yung mga CBC, mga ganyan, platelets, abnormal po yung kay Caleb nung pero hindi pa din po na-detect. So, dapat po maging parang careful tayo doon. Number 6 po, stay informed po. Stay up to date with the latest research and advancements in primary immunodeficiency. Hopefully, yung malapit na magkaroon po ng mas better pa na treatment other than the IVIG. Genetic testing, yun po yung ginawa sa amin actually po, nung nalaman po ng immunologist na ganun po yung result ni Caleb, sinabi na niya na, mami, pagdating ng ilang years or sa mga susunod nating step is yung genetic testing na. Pero for na mag-IVIG muna tayo kasi medyo mahal. Tapos itatanong pa daw po niya paano nga makakapagpa-genetic testing since dito sa Philippines medyo mahirap siyang gawin. So number 9 po, follow treatment plans. Medyo expensive po talaga yung IVIG treatments. Pero as parents, we really do our best po to provide para po ma-comply namin yung treatment plans para sa mga kids po. And number 10 po, educate your child. Katulad po nung sinasabi ko kanina, it is very important na you explain to them, anak, lalo po pag may isip na sila, anak, you should be careful. Pag nasa labas tayo, lagi kayo may mask. Pag ganito, lagi tayo mag-alcohol. Pag napansin mo, yung mga cousins mo may sipon or meron silang mga inuubo, i-inform mo ko agad. So, very important po na yung mga anak din natin is kasama natin sa journey. Sabi nga din po sa amin sa PGH po, pagdating po ng parang age appropriate na si Caleb po, may counseling po na gagawin for us, for the whole family po, including Caleb po, to explain to him. Kasi po, syempre pagdating ng right age po, mag-aasawa rin siya or magkakaroon din siya ng family. At least, alam po niya yung dapat gawin or dapat iwasan. Remember, early detection and management of primary immunodeficiency are very crucial po for your child's health and well-being. If you suspect or yung lagi nga pong paulit-ulit yung mga infections and yung hindi magamot sila ng simpleng mga antibiotics lang or mga paracetamols po, better po talaga na mag-consult ang parents doon sa qualified healthcare provider for proper evaluation and diagnosis and management po. Yun lang po. Thank you po.
Oh, nako, thank you so much, Ma'am.
Thank you for sharing. Opo, mabigat.
I know it's really very difficult for you and you have to be, what should I say, brave and strong.
Yes.
For boys. Pero talagang napakahirap nung dinadaanan ninyo, no? Kasi imagine dalawa yung anak mo na merong ganitong problem. So thank you that you were able to give us some time. Pero magandang sharing mo, Julie, kasi baka may mga nanonood sa atin na who will learn from your experience. So thank you so much. Thank you so much.
Thank you po.
Okay, Raymond, over to you.
Thank you. I think that's one of the more eloquently shared po na mga perspectives from a patient po. So thank you so much, Mami Julie. We'll ask you to open up your videos, pati si Dr. Joni. And while you're doing that, we will be showing our special public service announcement. Very, very quick break lang po for today. Go ahead.
Haloy, bilisan mo! Dali! Wala!
Ha? Ano nangyari? Ba't hindi kita makapitan?
Handa ka na ba, Kaloy?
Oo naman, ate! Nabakunahan na kami. May powers na kami laban sa inyo.
At hindi nyo na kami basta-bastang makakapitan. Yehey!
Sisiw!
Kaya mga bata, magpapakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center.
Thank you so much, TVUP, the COVID Communication Public Service Announcement. Just one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children aged 5 and above. Please share this video clip to all of your social media networks. Stay safe and stay well. Magpasama na po sa Bakuna Center. And we know you have a lot of questions po, no? But to get the ball rolling, Dr. Susie will ask the very first question po muna.
Okay, thank you so much, Raymond. And to both Joni and Julie, no? It's, what should I say? It's so complex. No? Parang ang daming kailangan isipin, ang daming kailangan i-test. Pero may solutions tayo. No? But I think what I wanted to ask was, both to Joni and to Julie, this is not easy. It's not easy because children are supposed to be healthy, di ba? Parang pag meron kang bagong silang na anak, no, you have a new child who's born, you expect that child to be able to live a normal life. But it so happens that it is not going to be that way. So I think my question more, and both for Julie and Joni, maybe Joni muna, is parang it's not just a medical problem, di ba? Parang kailangan talaga ng support for the family, both in terms of, Julie talked about mag-aral kayo, alamin nyo, di ba? Pero iba rin yung, yung support emotionally. Kasi ang hirap sa nanay nung, ito dalawa yung anak niyang may sakit na gano'n, no? So, what do we need to do to support our patients and the parents in a holistic way? So, I'll throw that first to Joan. Yeah.
That's very, talagang super agree ako. It's really very heavy burden kasi it's not only one patient. The mom, the dad, or the caretaker will think of paano yung kapatid, yung kahit nga pinsan, pwede, no? And then the next generation. That's what I want to emphasize to everyone na when you recognize IEI, you are hoping to save not just one patient, but a kindred, no? Sometimes ganon. So, it's tough. Parang yung mga cancer patients rin, di ba? Chronic illness. And then, may treatment tayo. I mean, it's getting brighter. Mas malalapit yung mga countries na who are actually willing to take our patients in. We have established networks with them already. So pwede natin ipadala yan sa Malaysia. I'm in connection with the transplanters there, no? And I'm hoping to send some of our doctors for training. So yung mga nakikinig dyan, contact me, interesado kayo, no? Definitive treatment yun. So kung makukuha natin yun, ang laking bagay. It will reverse the immunodeficiency. So it may not reverse the other immune dysregulatory problems, but the important yung fighting of infections, no? So malaking bagay. Unfortunately, ngayon, wala tayong sistema na parang okay, holistic na andyan lahat yung psychological support and yung nutrition and all. I think we have pala, correct, I have to correct myself. I think we have it in our training centers. So I know UPPGH has, no? So to learn more about it, it's really good to talk to the immunologist there. Meron tayo niyan. Genetic counseling, very important. Kasi nga, hindi mo alam sasabihin, uy, nasa dugo mo yan. Meron pang, stigma. So, ang hirap to handle that, di ba? At saka yung sinisisi mo yung sarili mo as a parent. So, dapat address yun. So, we have geneticists who talk them through it. Yung iba kasi, actually there are some that are not, no? That are not genetic. Kaya nga sabi ko, mostly genetic, not all. So, ma-explain sa kanila. Tsaka, it's not their fault. So, maraming cultural biases as well na, unfortunately, it depends also on the level of education of the family, no? Yung cultural aspects nila na we have to work through. So, yes, kailangan po natin ng mga therapists, ng mga psychologists to help us through, di ba, Julie? Tapos yung ginawa nga namin, nag-start tayo ng patient support group. So ito yung PhilPOPI. Kasama si Mami Julie dyan, very active. And group sila that they share the experience. We have an active Viber group, maraming sharing doon. So pag may ganyan, please let us know, contact any of the immunologists na board certified kasi alam naman nila kung sino yung PhilPOPI. So yan, maybe that's the way that we can help.
Thank you so much, Joni. Julie, ikaw naman. I think you talked about that a lot, no? Pero may nakakausap ka rin siguro na hindi taga PGH, no? So ano ba yung parang buong support na kailangan ng pamilya?
Sa akin, Doc, tama po yung nasabi ni Doc Joni na umabot po ako sa point na sinisisi ko yung sarili ko kasi ako yung carrier, tapos dalawa pa sila na nasalinan ko. So, unang-unang support po talaga yung husband ko kasi ano siya, parang nandyan na yan, wala naman, ako baga, nandyan na, binigay sa atin yan kasi kaya natin. So, yun yung ano, kaya na namin in a sense na we will do everything for the kids. Tapos po, yung isa po talaga sa malaking support system is yung family namin both. Kasi sila, kung ano yung pag-iingat ko sa mga kids ko, ganun din sila nag-iingat. Before po sila pupunta sa amin, lagi pong silang nag-check kung merong may symptom. So pag meron, walang pumupunta sa amin. So pag po na-hospital yung mga kids, lagi po silang nandun na, oh Julie, may kailangan bang food? May dadalahin ba? May kailangan ba kayong mga gamit na hindi nyo padala? Kami na bibili, kami na magdadala dyan sa hospital. Talaga pong yung buong family is naka-support po sa amin. Lagi pong nandun yung presence nila, tapos po lagi po nilang kinakamusta yung mga kids. Tsaka parang kami pong mag-asawa, parang naniniwala po kami na hindi naman po ibibigay sa amin yung mga kids kung hindi po namin kaya. So lagi po kaming, we're working hand on hand po. Lagi ko po kami magkatulong kung ano yung mga dapat gawin. Tapos yung mga future plans po namin mag-asawa, paano natin ito mape-prevent. Sana hanggang kay Caleb na lang, hanggang kay Calvin na lang, ma-stop na namin. So we're really working hard now. Talagang kayod kalabaw po para po maano namin yung mga bata, yung future nila at saka yung future granddaughter pa po namin kasi yung mga next generation probably baka maapektuhan pa. So yun po, family po talaga yung unang nandyan and together with the doctors po. Pag nakikita ko sila, actually malaki pong yung parang relief sa amin na parang they're doing their best po talaga to help us. Lagi pong nakasuporta yung PGH po, yung allergy clinic po doon. Pag may kailangan po kami, pag may tanong po kami, tinatanong din nila or lagi po silang nagbibigay ng mga advice kung ano po yung mga dapat namin gawin or dalhin lang doon. So malaking bagay kasi po sa BGH libre po yung clinic, libre infusion, libre yung mga doctor. So malaking bagay na po talaga yun sa mga parents po na nagdadaan sa ganitong experience po.
So Julie, anong ginagawa mo so that you can take care of yourself? Kasi I know you're always thinking about the two boys, pero you have to take care of yourself, right? So how do you manage that? What do you do?
Ano po, pinipilit ko po talaga na magkaroon ng enough na tulog. Kasi sabi sa akin ng kapatid ko, hindi okay yung ginagawa mo na lagi kang nagpupuyat. Kasi ganun din eh. Pag ikaw yung bumagsak, pag immune system mo yung bumagsak, yung anak mo mahahawa din pag nagkasakit ka. So we really have to protect ourselves po, kaming mag-asawa kasi kami yung laging lumalabas. So, yun Dok, aalagaan namin yung sarili namin. Tapos po kunyari may nararamdaman po akong something or tingin ko hindi masyadong normal. Siyempre, sa takot ko po na magkasakit or ano, not for myself eh. Actually, yung not for myself na kunyari, maaga ako mawala or ganyan, hindi po eh. It's for the kids kasi alam ko po na kumbaga ako yung pinakakailangan nila. So, I really need to be healthy. Kailangan po emotionally, physically, mentally po talaga okay ka. Kasi, paano mo aalagaan yung mga anak mo kung ikaw mismo mahina ka?
Correct. So, ano yun eh, importante yun eh na it's not selfish to take care of yourself, diba?
Opo.
Kasi you're doing it for your family as well.
Yes po. For the kids po talaga.
Okay. So thank you so much. It's such a touching story, Raymond. Parang,
That's true.
ay nako, Julie, you're very strong, very brave.
I really
Okay,
need to
what are your questions? What are your questions, Raymond?
Questions, I'll choose the one that Dr. Joni chose that she wanted to answer live. A question coming in from William Agner. Based on your experience po, Doc, what autoimmune diseases or conditions you have encountered that have a high possibility that they would later turn out to be permanent or irreversible, specifically common diagnosis of persons with disabilities linked to the malfunction of the immune system? So for Dr. Joni. Go ahead, ma'am.
Okay. You asked about autoimmune diseases, no? And malawak to, it's a wide spectrum, the group of autoimmune diseases. It can be very mild, no? Na can be treated by some anti-inflammatory or steroids, short term, and it can also be very bad. No? It can affect organ systems, multiple organ systems. For example, yung systemic lupus, no, SLE. So, from what I know, no, yung mga ganyang grabe, a lot of times they really are permanent. Okay, we are not yet aware of everything about autoimmune. That's the thing. Marami pa tayong aaralin. Kaya if we do not get to the real root of the problem, diba, it's hard to treat them. But yeah, unfortunately, marami talaga. So yon, yung mga rheumatoid arthritis, yung mga ganyan. So meron pang nag-evolve. Minsan, meron lang mga singaw-singaw earlier in their life, mild siya. Tapos later on, nababakbak na yung mga dila nila, yung mga ganon. So, and then, yeah, they can become worse. Meron namang iba na nakokontrol, no? So they can also live normal lives. But it's just so many, there's so many and more are getting recognized, and then they really are immune related. Kaya, even with them, not only the autoimmune problem, pati yung immune deficiency na nadidiscover, mas malaking problema yun, no? And that's why we have to diagnose, test, and then give the best treatment that we can para maging, you can live your life normally. I hope that answers the question.
Yeah, I have an interesting question on text, Raymond and Joey.
Good.
Let's talk about this. Sabi nila, totoo bang humihina ang immune system, lalo na sa mga batang masyadong malinis pagkabata pa? Kasi yung thinking na pag masyadong malinis, hindi natututo yung immune system na lumaban.
Theory.
Compared to, so parang sabi niya rito, yung mga mahihirap, wala naman silang protection, pero ang titibay nila. So, you wanna comment on that, Johnny? On having too clean, masyadong malinis, kaya nagkaka-allergy, nagkakaroon ng mga immune deficiency.
I'm not sure about the immune deficiency, kasi sa totoo lang wala tayong registry. We're still working on that. Ano yung demographics dito sa Philippines? Unfortunately, hindi natin alam. Pero yung sinasabi natin, when we talk about allergies, yan, nakita natin, ito yung tinatawag na hygiene hypothesis, no? It was like way back in the 90s. And they did say that yung profile ng immune cells ng mga tao na exposed sa farm animals, sa Europe ginawa yung test, bakit ganon? Less allergic sila. So parang matitibay sila. That is true because nga, there's so many interactions between the different parts of the immune system. So pwede kang protected from allergies because natuto yung immune system mo na ma-expose sa different triggers, no? So, but it's also not as simple as that. So, parang in general, may ganung trend. But you still have to keep a healthy lifestyle, no? Hindi pwedeng tapon mo lang sa estero yan, magiging matibay na yan. No. Merong ibang factors. Dito, marami pa rin tayong allergic na mga mahihirap, no? I'm sure sa PGH, tanungin natin yung mga doctors natin, na meron pa rin allergy sila actually. So, yon, there's a truth, there's some basis na nakita with what you were asking, Dr. Susie.
There's a follow-up question here. Sabi, yung mga sa developed countries, mahihina ang immune system nila, maraming may allergy sa peanuts, sa mga pangkaraniwang bagay, kasi hindi sila nagkakabulate. Sa mga bansa na maraming nagkakabulate, hindi nagkakaroon nitong mga allergy. What do you think of this, Johnny? Very interesting.
That's it's in the same vein as the hygiene hypothesis actually. So yung, di ba, yun kasi farm setting may mga chickens and cows and everything, kasama rin yung mga parasites at saka yung galing sa soil, no? So it's the same reasoning dahil naiiba ang modulation ng immune system na may tendency to protect from allergy and asthma. Pero again, wag don't
Pero,
think na okay lang yan.
Hindi, okay naman yan. Ako, I always believe my kids, pinaglalaro ko yan sa labas, sa lupa. Di ba? Kasi,
Yeah.
ngayon, of
Yeah.
course, if they have a recurrent, infection, that's a different thing. Pero, ito nga nakakatawa natutuwa ako dito sa mga tanong. Oh, thank you sa mga nagtanong, binasa ko ha. Oh. Okay, Raymond, go ahead.
The question naman po, one of the questions here, it's a PhilHealth question which we always have. Ito po ba, is this set of illnesses, does PhilHealth cover the health expenses of patients for this one?
Oo nga.
Ay nako, alam na alam ni Julie yan, no? Unfortunately, hindi. I don't know, Julie, was this directed to me? Or to
For
anyone?
both of you. Opo.
Both of you.
Meron ka bang experience natin, Julie, when you applied for it? Kasi ang alam ko, walang Z package, yung gano'n. We're really actually still working on it. Yung Rare Disease Act na yan that was approved in March of 2016, no? Kaya Pinoy pa yan, I was around and we were really working for that. Ang daming hindi natutuloy yung mga the steps that we have to take, and that is the only way that we can be mandated. So sa ngayon wala, but we're still trying. There was an effort last year to submit the first 5 most important IEIs para maisama sa Rare Disease Act. Pero so far, unfortunately, wala pa.
Julie, anong experience mo sa PhilHealth?
Sorry, Doc, kasi ko parang nawala.
The question po, Mami Julie, is what have been your experiences regarding yung nung na-hospital si Caleb, covered ba siya ni PhilHealth, yung mga something ganon about his disease?
Malaki po yung cover ni PhilHealth po. Dati po kasi yung infusion niya is kino-confine siya. So within 24 hours, pagka within 24 hours ka sa PhilHealth po, may mako-cover. Malaki po sa PCMC. Pero every 90 days mo lang kasi siya pwedeng gamitin. So, pero okay na din po. Malaking tulong na din. Close the door. Ito po si Caleb Ito po yung
Hello, Caleb.
Medyo underweight.
Asa si Caleb? Hi, Caleb.
Tapos po, PhilHealth po, malaki po yung coverage. Nung na-COVID siya kasi po, medyo malaki po yung bill namin, 1M. Yung na-cover po ni PhilHealth is 350,000. Tapos po, plus the PWD, which is 20% po. So, na-cover din po yun. Sa mga medicine po nilang dalawa ni Calvin ngayon, parehas po silang may PWD under RA something. May RA po na Republic Act for mga rare diseases po. Covered po sila nun. So, malaki din po yung nababawas sa medicines nila. Sa PGH ko din po kasi yun kinukuha. So, yun po yung mga nagagamit po naming mga benefits for them. Pero wala pong kumbaga po mas extensive. Pero po meron po kasi ko nakakausap na isang parent, dalawa rin po. Kasama rin po siya sa PhilPOP po. Dalawa rin po yung anak niya na parehas na lalaki, na parehas XLA po. Nakakakuha po siya ng mga pledge, parang mga ganun po. Guarantee letter po. So, yun po, nakakalapit po siya sa MSS po. Tapos tinutulungan din po siya ni MSS.
Thank you, Julie. Naku, umiinit ang ulo ko, Raymond. Kasi nung nasa PhilHealth ako noon, we were asking that question. What's the basis for 90 days? What's the basis for that? Why would you say you can only claim within 90 days? Is it that you can't get sick after 90 days? Naku, mainit ang ulo ko. Okay, game. Ituloy mo na, Raymond. Iba na yan, hindi na maglarang.
Okay. This one
Last
naman
question
po.
na tayo.
Last question. And from the Institute of Human Genetics of NIH. It's more of sharing, but there's a question sa dulo. Good day. During my baby toddler days, I was colicky and usually got sick, prone to rashes and respiratory infections. As I grew older, my admissions decreased to once a year, whereas my siblings never had to get admitted. I don't get as sick now as an adult, but was diagnosed with chronic urticaria. Was told that the reason I was sickly was because I refused to drink my mother's breast milk as a baby. And her question was, is there a link between breast milk and overall immunity of children? Yun po ang kanyang katanungan. Dr.
Nice.
Joni.
Okay. Syempre, we have to distinguish, no, pagka tayo ay pinanganak na merong inborn error of immunity, walang kinalaman yun, yung milk na yun, kasi yung genes mo, simulat sa pulpa, hindi ka pa lumalabas, nandun na yun. So, on the other hand, in a person with a normal immune system, alam natin na may mga talagang nutritional factors that help us, lalo na sa baby, to parang it sets you up na you'll be really more healthy, no? Maybe less allergies. Pag ikaw ay nag-drink ng breast milk ng mommy mo, sana nga kung pwede at least 2-4 months or a year. Kasi may mga factors doon. Sa breast milk lang ng mommy, ha, hindi yung canned, yung mga yung mga colostrum, yan yun eh. Meron sa mommy, may mga IgA, good antibodies yun for protection. Not the canned, not the colostrum, yung talagang from the breast, no? Yung mga HMOs, no? They are known to really beef up yung ating immune system, vaccine response, no? So, I don't know, I wasn't there nung bata siya, bakit siya mas sickly, pero I'm also surprised na you will refuse your mom's milk. No, parang I'm not sure, siguro dapat explain what it means kasi I have not heard of anyone refusing their mom's milk, at least for the first year. So maybe after that, may preference ang taste, no? So siguro iisipin mo rin, bakit kaya nag-shift siya ng preference? Baka pinapakain sa kanya maraming sugar.
Oo,
So
baka
yung
nag-mix.
dietary.
Baka mixed feeder.
Yeah. Oo, so after that, namili na siya. So, pero yun nga unfortunate, kaya nga dapat di tayo bibigay ng sugar sa mga babies kasi it sets them up for all the metabolic syndrome, the metabolic diseases, obesity, heart problems, no, diabetes early in life. So, nakaka-affect rin ng immune system yung mga metabolic diseases na yun. Okay.
Thank you so much, Johnny. Naku, we want to continue but we don't have any more time. Raymond, let's go to our fun quiz.
Okay, can we have those two questions sa Slido po at saka sa Zoom poll here, and then we'll ask the question to Dr. Joni for the correct answer. Can we have it on the screen? Okay, thank you so much. So Dr. Joni, I'll ask the question and then you'll tell the audience po the correct answer. So what are the 3 red flags serve as a basis for having a high index of suspicion in a patient having inborn errors of immunity? Alin po sa 4 ang tamang sagot, ma'am?
Okay, majority. Ang answer ay letrang A. So need, yung tatlo, di ba, in-emphasize ko yun, IV antibiotics, yung need for IV antibiotics, failure to thrive, and failure to gain weight or grow normally, and family history. Yan.
Okay. And then for our second question, the management strategies available for patients diagnosed with IEI.
Yes, so it says letter A is the stem cell, B, immunoglobulin, C is prophylactic antibiotics, D is genetic counseling, E, it's all of the above. And the answer is all of the above. So, ang dami nakakuha.
So sana po our audience takes note of those things. Lalo po sa question number 1, medyo mahirap po yun. Baka makalimutan po. But very, very important, and we're thankful for Dr. Joni for telling us of the correct answer. So at this point po, no, we'll take this time to do our evaluation poll po muna. And while we're doing that, we will be asking Mami Julie tsaka si Dr. Joni to come up with their maybe 1-minute last or final message to our audience that you would like the audience to take away from this webinar. So as we're doing that, we'll go through the 5 questions of the panel discussion poll. Shown on the screen, we are not sending out separate evaluation polls. Ito na lang po iyon. It's a 4-point Likert scale, and as follows, the panelists demonstrated thorough knowledge of the topic. Question number 2. The panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, number 5, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will not be closing this until the end of the webinar as we move on to the final messages from our speakers. Dr. Susie.
Okay, thank you so much. We'll start with Mami Julie. Ano ang mensahe mo sa mga nakikinig ngayon dito?
Siguro po yung mensahe ko sa lahat ng nakikinig at makakapanood po ng webinar natin is trust your instinct. Kasi po, pagka there is something wrong, ramdam mo eh. So you really have to take care of your kids, monitor them well para po alam mo na merong hindi naman po hindi normal, yung hindi dapat hindi ganoon eh. Lalo na po sa primary immunodeficiency, ang mga dapat tandaan nila yung paulit-ulit yung infections na hindi siya nagagamot ng simpleng mga antibiotics na kailangan silang ma-confine. Tapos po yung kailangan din po talaga na maging hindi na knowledgeable. Kailangan po ikaw bilang nanay or bilang parents po, kailangan po na aralin mo din kung ano yung mga nararamdaman ng mga anak mo. I-take note mo yung mga nakikita mong symptoms at lagi mo yun tatandaan. Kasi po pagpunta mo sa mga doctors, yun yung paulit-ulit nila itatanong from birth, ano yung mga symptoms. So kailangan po talaga na alam mo yung mga experience ng anak mo, and you really have to be in their journey. You have to be in the lives of your kids para po hindi nila maramdaman na bakit mama bawal ako lumabas, yung hindi nila maramdaman na iba sila and they can live a normal life.
Oh, thank you so much, Julie. I love that. Trust your instincts. Galing. Thank you, Julie. Okay, let's go to Joni, Dr. Joni Santos Ocampo. Joni, take it away.
Yes. I have a message for the clinicians listening to us, kasi actually kayo yung target audience namin eh. No? You have to have your clinical eye, Meron rin tayo na gain na instinct, when we were training. And then you have to act on your suspicions, Madali naman magtanong, 'di ba? Curbside. Don't hesitate to refer because IEI or primary immunodeficiency is really a complex disease. Don't think na we expect you to know everything, and that's why we're here. That way we are going to be true advocates for our patient, 'di ba? So we're here, you call us. We're ready to talk anywhere, anytime, no? And then my message for the patients, the same with Julie, trust your instincts talaga. Many times nasasave ako niyan, lalo na with my pediatric patients, So then you look for a doctor who will attend to your questions, Who will not poo-poo it, yung, okay lang yan, normal yan. Don't fall for that, Kasi if they cannot explain to you, you're really better off to look for someone else. I'm a mom also. That's why I'm talking same as a doctor and a mom. And you all can also try to empower yourself by going into the internet, but never without the guidance of your doctor. Maraming fake news. So please, alone. And then matatakot lang kayo. Maraming maling information. And I think that's it,
Thank you so much, Joni. What a great topic and presentations from both of you. Maraming salamat. Raymond, let's go to our evaluation before we call on Stella.
Okay, for our evaluation po, it's still open, but we're seeing that at least 92% of all of our attendees strongly agree, which is a testament po of it being very well received. And a lot din po are saying, not just by their presence, but here in Zoom, but also in Facebook and in YouTube, and as well as in the comments, that they learned a lot about primary immunodeficiency and inborn errors of immunity, and not to really ignore those signs and symptoms that we usually do. Okay, Dr. Susie?
Okay, thank you so much, Raymond. For our synthesis and closing remarks, we'd like to welcome Dr. Stella Marie Legazpi-Jose, who is the head of the UPPGH Office of Expanded Education and Training. Stella, go ahead.
Good afternoon, everyone. Thank you for attending our webinar. It's a very interesting topic. Dr. Joni Santos Ocampo explained about immunodeficiency. She said it's the failure of the immune system to protect us from infection due to the absence or insufficiency of some component, process, or substance. So there are two kinds. We have the innate error of immunity, what she called IEI, and the secondary immunodeficiency or acquired immunodeficiency. Now, the first one, the IEI, is an inborn error of immunity, and this is caused by genetic mutation that affect the immune system, and there are no other causes. The secondary immunodeficiency is when the patient has immunosuppression or immunosuppressive drugs. So it can be drug-induced or diseases like AIDS and lymphoma, and it can mimic IEI. She mentioned the word SPUR, so let us remember that. S is for severe, P is for persistent, U is for unusual organisms, and R recurrent or recalcitrant to treatment. So mahirap pagalingin. And she said, ito yung, I think it was mentioned in our other webinar where Joan is also a speaker, yung warning signs of primary immunodeficiency. Number one is failure of the infant to gain weight, the need for IV antibiotics to clear infection, and the family history of primary immunodeficiency. She said that the laboratory tests, so yung mga lab tests are not very accessible, the CBC, the absolute neutrophil count, and the absolute lymphocyte count. And she also mentioned others. The management is first the hematopoietic stem cell therapy. It's given before 3 months of life. It has the best overall long-term survival. And also IVIG was mentioned, and it is beneficial in 70% of patients. She said that we have to prevent infection, so you have to vaccinate your child against BCG, against COVID, and the use of prophylactic antimicrobials. She also mentioned the availability of blood products, genetic counseling, and support groups. In summary, she said, be aware and be updated. So you should have a high index of suspicion and lower threshold to refer. So wag natin i-ignore at sabihin ganyan lang yan, ganun talaga. No, let's be more proactive. And the basic test can the screening is available, and if in doubt, it's best to consult an immunologist. I really salute Mrs. Julie and Amora, and her narrative was really heartwarming and heart-touching. So she mentioned the 10 aspects that a mother should be aware of. Number one, be educated and be aware. Yeah, that's the purpose of this TVUP. This is for you, for all the mothers out there, whether you're a doctor, a nurse, or medtech. This is for you. Listen up. It's important that you know what's happening. Number two, there should be family support. If there is family support, the problems become lighter. Third is monitor your child's development. Lumalaki ba siya ng tama? Tama ba yung timbang niya? Tama ba yung height niya? And this can be monitored, especially with your pediatrician. So, number four, consult a pediatrician. Number five, she said, monitor the lab request, the lab results. So, these are important. So, you will know if something is not going right. And number six, stay informed. And seven is genetic testing. We have genetic testing, by the way, here in the National Institute of Health. So I'm giving that advertisement. So you can easily get in touch with our geneticists. And number eight is follow the treatment plan. Number nine is follow the health management. So sundin natin po anong advice ng immunologist and educate your child. Thank you very much, Judy, for your well-delivered and concise narration. Back to you, Susie.
Okay, thank you so much, Stella. And again, we'd like to thank Julie and Joni for this excellent webinar that we have just had on a topic that's not frequently discussed. So next week, I hope I have my voice back.
That's true.
Yeah, and thank you pala, Stella. Ang ganda ng synthesis mo. Department of Ophthalmology and Visual Sciences. So pag-uusapan natin ay mata. Okay. Thank you, Raymond. Over to you.
Thank you so much, Dr. Stella Jose, for that concise and very very important po na nuggets of wisdom from that summary for this webinar. Thank you to Dr. Susie. Hope you feel better soon next week po when we do our webinar again. But before we conclude our program, we'd like you to know that all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. You'll just need to go to www.youtube.com/TVUPPH for you to be able to see all 140 webinars. After today, it will be 141. And then also what we lovingly call as SCD Shorts. These are selected presentations being featured po dito po sa YouTube din po. So maraming salamat po sa lahat-lahat. Thank you to PSAAI, Dr. Joni, maraming salamat. And thank you also, hindi po madali pero maraming salamat po and we really appreciate it, Mami Julie, for sharing your experiences and hopefully your family will be feeling better, be much better po in the coming years. So this formally closes our webinar for this week. Magkita-kita po tayo again next week sa ating Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.